3 key pieces of advice would you have for a patient who has just been diagnosed with advanced non-melanoma skin cancer?
I actually spent a lot of time thinking what those 3 key pieces of advice would be. And I think the first one is, number 1, do your homework. Don't just take anything for face value. I tell my patients, this is your life. If you go and do research about what appliance you're going to put in your kitchen, I think you should also do a little bit of research about what doctor you're going to allow care for you. And so I always tell everybody, did you do your homework? Are you sure you're in a place that is going to be able to provide you with the care that you need? Are the physicians that you're seeing experienced in the disease that you have? Because they may be brilliant physicians, but they may not have any expertise in that particular area. And so I think it really behooves people to, I tease my patients, I ask them if they go to Google medical school and really find out a little bit about our backgrounds, find out about the institution that you're going to, and learn a little bit about the disease. I'm certainly not saying come in and tell us what you want to have done, because I would hope that it takes many years of training and expertise to know how to make a good decision. But I think the more that patients know about the physicians that they're seeing and their level of expertise and their interest, the better the outcome's going to be. So that's number 1. Number 2 is consider a clinical trial. If you are a candidate for a clinical trial, consider it. We are taking promising agents and looking for ways to make patients have better outcomes. And so many times when we talk about clinical trials, we know about the drugs, we know about their side effects, we know their efficacy, but we're looking to find ways to make those drugs work even better. And sometimes it may be adding radiation to one of the standard drugs we have. It may be adding, a different type of targeted therapy to the medicines that we have. Sometimes it's actually taking a research medicine that looks really, really good and very promising and adding that extra research drug to a standard drug to see if we can't do better. And so that, I think, is really my second point of advice, is really consider participating in a clinical trial if it's applicable. And so what's my third one? My third one is to really make sure that you can communicate with your team, that you trust your team, and you feel comfortable with your team. There are many of us who have the expertise, but we all have very different manners in which we communicate and talk to patients and speak with family members. If you're not comfortable with the person that you're seeing, there is absolutely nothing wrong with going to get a second opinion to find someone who has the same level of expertise, who may just fit your personality better. Everybody's different. You have to find the healthcare team that fits for you. And I think that's so important, because you're trusting us with your life. And if you don't feel comfortable, then we shouldn't be the ones taking care of you.
Yeah. This is all about self-advocacy. The more you know, the better care you're going to get, and the more comfortable I think you'll feel with your treatment.
Correct.
Yeah.
And again, I think treatment, yes, people come to us for our recommendations, but it really is a team effort. My feeling is that the more that patients understand why we're doing what we're doing and are part of that decision-making process, the smoother treatment goes. I really think education is important of the patient and the family. I think being able to ask your physician questions without feeling that you're threatening it's something you should be able to do. And I think it just provides with better care.